Yeah.
Hi guys, Dr. Alicia and this is Dr. Sarah. Welcome today. We wanted to have a chat today to help you prepare for your best birth. We see so many women coming out of their birth experience feeling disappointed in themselves or on how it went or in how they performed. And we don't want that to be you guys on your special day. So today we want to talk to you about what you can do during your pregnancy to actually help you prepare to have your best birth possible. First, we're going to take a moment just to let you know a little bit about who we are. And so Sarah popped that link to our best birth guide in the chat box. So if you didn't get it via an email, then go ahead and download that right now. Just so you know, by downloading that, you will be signed up to our email list. If you want to join our email list, we put out a weekly email. We call it the Bump Blast on Wednesday. Get it? Bump instead of hump. And we have all kinds of free contents. We do YouTube videos, we do podcasts, we do Instagram, we do TikToks for as long as that lasts. And so any new content we put up in that and send out just a once a week email to update you on those things. So hopefully you like that. If not, feel free to unsubscribe at any time. So I'm Dr. Alicia. I'm a family doctor and I specialize in maternity care and care of the young families. I've been doing it for about 10 years now, which sounds so crazy, but it's true. And I love what I do. I love helping families welcome their little ones into the world and helping guide them through this amazing, but what can be a challenging time through pregnancy and the postpartum time. I've got two little kids of my own. Well, they're not little anymore, 6 and 8, and they both came into this world in very different ways. My son was post-dates. I was induced. He actually had a really tight nuchal cord and needed some extra help during delivery, but had a nice normal delivery. My daughter came a little bit early and was an emergency cesarean section and ended up being in the neonatal intensive care unit for 3 long weeks. So I've got a breadth of experience just from my own 2 kiddos of what women and their families can go through. And I really learned why it's so important to go into your birth prepared for all the possibilities that might happen, just so you have that knowledge in yourself.
So I'm Dr. Sarah, and like Alicia, I'm also a family physician that specializes in maternity and newborn care. There are 2 things that you should know about me, and the first thing is actually that I didn't start my training as a family physician. I actually started to train to become an OB/GYN, so an obstetrician gynecologist. I spent about 2.5 years of my life doing that, and I loved it. But after hundreds of cesarean sections, probably over 500 vaginal deliveries, and probably thousands of hours on call, I decided to change course to family medicine for a multitude of reasons, but I knew I could still be able to do maternity care and women's health. I'd have a bit more control over my life and schedule, and I could have a family of my own. So the second thing is that just like Alicia, I too am a mom. I have 3 young boys. They are 2, 5, and 6. And like Alicia, every delivery was unique and unforgettable experience that has undoubtedly made me a better care provider. You know, because not only do I have the experience of my years of training, but we've also been through it ourselves. And I think that really gives us a unique perspective to provide care and to provide education to you. So if anyone's just joining us, make sure you've got your free best birth guide. You should have gotten it emailed to you. And if you don't, we popped the link in the comments and you can download it. And now we're going to go through the 5 ways that we think you can prepare for your best birth.
So just patience while I figure out how to, but are they seeing us or this is what they're seeing?
No.
Great, perfect. Never mind. So Dr. and Sarah and I truly believe that through knowledge, we can empower women to create joyous memories and relish in all that is good about these experiences, rather than dwelling on the things that did not go the way they thought they would. And this is what we find so much during birth experiences. Women have expectations that they go into, and if those expectations aren't met for whatever reason, there's disappointment. There's sometimes feelings of failure, even though they made it through this amazing event, came out the other side, a beautiful baby. So we really want women and their families, their partners, their support people to go in with hopes and dreams, but also clear expectations of what all the options could be and when they might feel like they would be willing to accept those options, so that they can come out the other side feeling empowered and feeling joyous and having fond memories of this amazing day, because it truly is one of the most incredible experiences any parent will ever go through. So first, we want to talk about support. Support is so important. The quote is, it takes a village to raise a child, and we say this for a reason. And none of us can do everything on our own. We all need to surround ourselves with supportive, useful, caring people who will help us move towards our goals. So we're going to chat a little bit about the different support people that are possibilities during your pregnancy, labor, and postpartum experience, and how you can help make them more useful supports and help them feel more empowered to support you. So first of all, your care provider. So by now, most of you have probably chosen a care provider, and hopefully you feel like you're connected with them and that you trust their knowledge and understand what they're saying to you in regards to your pregnancy, any complications that come up, when you have questions around deliveries, they're able to explain it in a way that you understand, and that if you don't understand, you feel comfortable enough to ask them questions around it. So believe it or not, most of us actually have your best interests at heart. It may not always seem that way, but if it doesn't seem that way, make sure you ask us what's going on, because there's often something else going on that we just haven't explained to you, maybe in the best way possible. And if we just rephrase it, then we can reframe how we're all approaching that situation. So support in pregnancy. Now this is key. These are your support team around you, your friends, your family, your partners. We all have those toxic people around us who say things that are so hurtful, whether it's not what they intended or not, but that's not what you need during pregnancy. You need to surround yourself with friends and family who are positive and kind. The last thing you need during this time is people who bring you down or make you feel bad about yourself or the decisions that you're making. This is your pregnancy, this is your birth, and therefore you are the one who gets to make those decisions, and it doesn't matter what anybody else thinks about them. So support during labor. Now, we're in the time of COVID, so it's a little bit different right now. Certainly in our city, you're allowed one support person with you in labor, and that's the same support person throughout that time. Other places, you're allowed some more, and I think some places they're not allowing any support people. But in general, you want to bring the people with you into your labor that you want to be there. So if you don't have a partner that's able to be there, make sure that you choose somebody who is going to be supportive and who you feel is going to help you through labor, because it's about you and your decisions. It's about your family that you're creating during this time. Don't bring people in who you don't want to be there. Don't feel pressured to have people at your delivery that you're not comfortable being there. They have or will have their own opportunity to be at their delivery. They do not need to be at yours, and change the experience for you. So this is your birth, you get to decide. If you're in an area that you're allowed more than one support person, or your support person can't be there with you, consider a doula. Doulas are amazing. They're actually trained to support you through the early labor, and even postpartum period. So if you don't have somebody who you know would support you well, then that is always a consideration as well. And even during this time of COVID, a lot of doulas are doing some virtual work. Yeah. And so they can actually do some online kind of virtual visits with you to help talk about how your partner could support you more effectively during labor, and help teach some tips and tricks around that. So that's another great option. We actually just did a podcast on acupressure in labor, and that's a great way for your partner to support you in preparing for your delivery, but also during your delivery. So check that out on the She Found Health Motherhood podcast. So postpartum support. Now, the fourth trimester, as it's termed, is the first 3 months after delivery. This is a time of huge changes and huge transitions. You're going from being a single entity who was supporting your baby inside to being two separate people with your support people around you. Relationships change, your body has changed. It's a time that you're learning what to do. Your baby is transitioning from being fully dependent on you to a little bit less dependent, still quite dependent on you. So it's a huge change, and you need people around you that can help support you through that in a positive and meaningful way. So some great ideas around that is people who are going to visit you doing something useful. So if they're part of your bubble right now and they can come into your house, then having them clean your house, or do your laundry, or cook you a meal, or snuggle your baby while you have a shower, but make sure that when you want your baby back, they give it back to you. Another incredible support is breastfeeding support. So if you're choosing to breastfeed your baby, that can be a very challenging thing the first time. There's two people who don't know what they're doing. And so nobody should expect that it's going to go easy right off the bat. But learning some tips and tricks, or having a lactation consultant to come and support you or do some virtual support with you, it can be an amazing thing. There's a wonderful website called www.firstdroplets.com that is an incredible amount of information for those first few days and how to really establish that breastfeeding journey off. So I highly recommend people do that, firstdroplets.com. And then we also want to make sure that you have time during that early few days postpartum to really bond with your baby. So if you're going to have visitors, make sure that they're coming for a very short period of time, or delaying their visit until 5 to 7 days when your milk's established, you've figured out breastfeeding, because you're going to really want to spend a lot of time bonding with your baby, skin to skin. There's going to be frequent feedings during those first few days postpartum. So if you have too many visitors coming in and out, it can be quite disruptive to that early kind of attachment, bonding, and breastfeeding establishment.
Yeah, people often say don't invite visitors that you don't want seeing you naked.
Yeah, exactly.
Yeah. Okay, guys, next up, step number 2 is preparing your body. So you may have heard people say labor is a marathon, and it truly is. Your uterus is actually a huge muscle that contracts regularly every few minutes from the beginning of labor until the placenta is delivered. And pushing your baby out is honestly comparable to about a 2-hour HIIT or CrossFit workout. So it's important to be prepared, and it's important to stay active in pregnancy. But it's also important to know that exercise can take many forms. So it can be anything from walking to running, swimming, prenatal aquafit, strength training, yoga, or even tennis. What we recommend is a minimum of 3 to 4 days per week for an average of 45 minutes. Not only does it help you stay fit and strong and prepare for labor, but it also will help you stay more comfortable during your pregnancy. It can help reduce low back pain, pelvic pain, all those common aches and pains of pregnancy. So, low back pain is extremely common, and if you can stay active throughout the pregnancy, it's going to be hugely beneficial to you. And not only does it benefit your physical health, but it can also help your mental health as well. There's excellent evidence that regular physical activity helps decrease mood disorders like anxiety and depression in pregnancy and the postpartum period. And like we mentioned above, labor is a super intense workout. Being fit and strong will not only make your labor experience easier, but it'll also help your recovery. So, if you're not active, one tip we would say is check with your care provider before you start any new activity in pregnancy. If you've been inactive before, it doesn't mean you need to stay inactive. You just need to have, a safe approach to starting to become active throughout the pregnancy. And there are a few activities we actually recommend avoiding in pregnancy. You probably won't be surprised as I list them. These include scuba diving, contact sports, horseback riding, mountain biking, and any activities that really increase your intra-abdominal pressure. So things like powerlifting, where you're bearing down, or any other weightlifting. It's also important to know that as the pregnancy progresses, you likely need to modify how you do things. Your body's changing, and you need to adapt to that. So listen to your body, connect with your care provider, but stay as active as you can, and be mindful that your body changes closer to your due date. You may notice that you need to, get yourself a pelvic support band to help support as those ligaments are stretching and making space for the baby. And don't hesitate to connect with a physiotherapist or get massage from a registered massage therapist throughout pregnancy, and that can all help keep you comfortable, keep you active, and prepare for your birth.
Now, just a little caveat to what Dr. Sarah said. Mm-hmm. The weightlifting, you can weightlift.
Yes, not all weightlifting is
just, we're not going for our max weights. We're just going to scale back a little bit.
Supersets.
So keep doing the activities you've been doing, as long as there's not a big risk of abdominal trauma, or there's not a lot of grinning and pushing associated with it. But otherwise, it's fine.
Absolutely.
Yeah, great.
And if you don't know, ask your care provider.
Yeah, totally.
Yeah, we're always happy to offer advice.
Okay. So we love a good birth plan, or as we like to say, we love when you think about what your birth preferences are. So what do we mean by a good birth plan? We mean a document that you and your partner or your support person fill out that does these 3 things. 1, it encourages you to get to know your pregnancy. What is your blood type? What is your group B strep status? Have you had your swab done yet or not? Do you know? That's usually done around 36 weeks, and we need that information for when you rupture your membranes. Do you have any complications of pregnancy? Do you have hypertension in pregnancy? Or do you have diabetes that's come up in pregnancy? Or do you have other medical issues that you know are going to be something that could complicate your pregnancy? Do you have a clotting disorder? Do you have type 1 or type 2 diabetes that were an issue before you even got pregnant? Have you had a previous cesarean section? That's an up and down incision as opposed to a classical lower abdominal incision. So those are all things that could complicate your birth process. This is really important for you to know so you can communicate it to your team. So the birth plan is a communication tool. So 1, it allows you to really get to know your pregnancy. The next one thing that's really important is to start thinking about what interventions you would accept and when. As Dr. Sarah and I said at the very beginning, both of us went into our labors expecting to have nice, normal vaginal deliveries. And one of the 5 of them actually went that way.
Yeah, my third.
So it's really important to have your hopes and dreams and expectations, but also think about under what circumstances would you be willing to accept a vacuum delivery or a cesarean section or an intravenous medication. And that is going to be different for everybody. But I think at some point, everybody would eventually accept those, for the most part, those interventions. It's just a different place that you might be in that you would accept it. So really important not to think about what you would accept and not accept, but think about under what circumstances would I be okay having X, Y, or Z, and communicating that with your care team. So that might be pain medication, that might be an intervention. If you're planning on a home birth, that might be when would I go into hospital, and communicating with your team what your wishes are and what your preferences are. The third thing is, once you've gone through the birth plan, it allows you to have a better understanding of what the possibilities are. And if you don't understand it, to talk to your care provider about your questions. So asking questions, gaining a better understanding about what are the options for pain medications, what might be the indications that I would need to go from my planned home birth to a hospital birth. What would the reasons be that I would need an emergency cesarean section? And having those discussions before you go into labor. We are all fans, healthcare providers are all fans of informed decision-making. And in the middle of a complex situation, it's really hard to make an informed decision. So if you do the information gathering beforehand, you can have a much better understanding of what's going on during that time, and be able to make the decisions that are right for you and your family.
Absolutely.
So we actually have a birth plan with birth preferences on our website. So you can just go to it, www.shefoundhealth.ca, if you are interested in downloading that. We can also put a link in the chat once we're done this part of the chat and we're getting into the Q&A portion.
Yeah, for sure.
Yeah.
So next up, guys, step number 4, preparing your mind. This is truly a powerful tool. Mindfulness in pregnancy. It can help you not only manage your mood and anxiety symptoms throughout pregnancy, but also really helps you prepare for your labor and delivery experience, as well as becoming a new parent. There's actually a growing body of evidence that is starting to show mindfulness can decrease depression and anxiety in pregnancy, and even boost positive emotions. And there's actually evidence that's looked at its impact in labor, and it's shown to provide more satisfaction and empowerment in labor. So women who have practiced mindfulness in their pregnancy generally are more satisfied and feel empowered during their labor and delivery experience, which I think we all want. So what exactly is mindfulness? So the definition of mindfulness is it's a quality or state of being conscious or aware of something. So, it's really just being present in the moment and being aware of that. So you're acknowledging what you're feeling, what you're seeing at that very moment in time. So mindfulness can seem really overwhelming to a lot of people because they just think, oh my gosh, I have to sit there and meditate and have an empty mind. Trust me, if I can practice mindfulness, anybody can. So there's a lot of great resources that can help you slowly incorporate mindfulness into your day-to-day. We've mentioned some of a few of our favorite apps there. These are all downloadable, free from the App Store. So these include Mindshift, Calm, 10% Happier, and there's tons more out there. So these are just a few that you can try out. And you know, they have like as short as 1 minute, 3 minute, 5 minutes, and some of them are guided meditations that just teach you how to connect and be aware of what's happening with your body. There's also some really good evidence about hypnobirthing. Now, neither Alicia and I are experts in hypnobirthing in any way, but hypnobirthing techniques seem really similar to some mindfulness strategies. So incorporating some mindfulness practices is probably a good transition or preparation if you want to learn some hypnobirthing techniques as well.
Yeah. The other thing, I was doing a podcast with one of our local traditional Chinese medicine practitioners, and we were doing it on acupressure. We're also doing one on mindfulness in pregnancy and postpartum. That's coming out later in the summer. But she was talking about reframing how you think about pain of labor. And through the mindfulness and through hypnobirthing, I think they speak to this, is reframing how your body reacts to the pain of labor based on what you feel about it. So most pain is crummy. Nobody wants to be in pain. It's horrible. There's never a good outcome. But the pain of labor is actually a productive pain. There's something wonderful coming at the end of it. You have to get through that pain to accomplish your end goal, but it's actually a productive pain. And so if you can use your mindfulness and your hypnobirthing to reframe your brain on how it thinks about that pain, you can actually allow your body to settle into the pain and work with it to get your end goal of a healthy, safe, happy delivery, whatever that way is. So
it's amazing.
It's truly incredible.
Yeah.
So
let's get meditating.
Yes. We'll start meditating right now. So as you've heard from us, knowledge is power. And we truly believe that with knowledge, you can empower yourself. By knowing what to expect going into childbirth and all the possibilities that you're more likely to kind of feel proud and happy with your experience coming out of it. We see women all too often who went into birth unprepared with unrealistic expectations of what childbirth can be like. And they come out disappointed because they didn't get the birth that they wanted. They got a different birth. But this is going to be one of the hardest, but the most joyous experiences of your life. And we really want you to come out of that feeling strong, feeling empowered, and having good memories about that experience. Even though it hurts, even though it can be very long, even though it can be grueling and one of the hardest things you ever do, we want you to come out of it feeling joyous and happy and proud and empowered. So what are the ways that we can help empower ourselves with knowledge? Well, learn all you can. Talk to your friends about their birth experiences. How did it go? Why did that happen? How did they feel about it? And you'll soon realize that there's no two experiences that are ever the same. And rarely do they go as we expect. And that's okay. Talk to your care provider if you have questions that have come up with discussions with your family and friends. If you've heard about some complication that your moms and your sisters and your aunties all had, talk to your care provider about it because it may actually be an important piece of information for us to know about as well. And the third thing is to take a prenatal class. Prenatal classes can be absolutely amazing. They can provide you with so much information. On the other hand, they can be somewhat unrealistic at times. So we think it's really important to take a prenatal class that is a broad range of topics, goes deep into those subjects, and is taught by people who are actually in the room with you, helping you make decisions. So who can that be? Those would be kind of nurses, doctors, midwives. We want you to take a course that covers preparing for the delivery. So what do those last couple of weeks look like? What will you expect? How can you actually prepare your body for the delivery so it's going to go more smoothly? We want there to be a portion on the childbirth, so the labor part and the delivery part, and all of the options that are in those. So pain management options, cesarean sections, vacuums, forceps. What if you have a twin delivery? What if you have a previous cesarean section, you want to have a vaginal delivery? What happens if my baby needs more support? All of those should be covered. We also think it's really important because it's such a huge transition into that postpartum period that there's some good solid information in there around the first couple of weeks and what to expect for you and your baby postpartum. We also think it's important to take a course that fits into your life. all too often we see couples struggling to find a course that fits because they can't do weekends or they can't do evenings, and both of them want to be there to take the course together, but it's hard to find one that fits into your life. So there's certainly online courses now that that you can do from your home in COVID. Oftentimes they're still scheduled, but certainly there are some that you can watch whenever you want. However often you want to. You can replay sections, or you can watch it, and then if you find something interesting for your partner, you can bring your partner in and watch it together as well. So there's lots of options out there, but find one that fits your life and gives you the information you need to make the right decisions. So there you have it. Those are the 5 top steps that you can take today to empower yourself for your best birth. We would love to hear any questions that you have. We're happy to answer general questions. We can't do anything super specific because we don't know you in your specific case, but we're happy to answer any general questions that you have. And while you're doing that, we actually have a question for you.
So while you're jotting your questions in the question box, in the chat box, we want to know, do you feel prepared for childbirth? Do you know what things could look like? And do you feel you have the knowledge to make important decisions throughout your labor and delivery to keep you and your baby safe? You can see from the information that we've shared how important it is to be prepared and informed going into your birth, and how powerful you would feel if you felt ready for whatever unexpected turns your labor and delivery experience might take. So we actually want to share an opportunity for you today. In our experience, we find that many families do not feel prepared. So we actually created an online prenatal course that we think covers it all. Megan took our course and she said, I took another prenatal course and it barely touched the surface of the information that Doctors Sarah and Alicia had in their course. I was amazed that they were the same price for all that extra information. In our course, we cover everything from preparing for your childbirth to what to expect for both the mom and baby in the early newborn period. We're going to take just a few minutes to tell you a bit more about our course.
So in the preparing for delivery section, we have sections on packing your bags to creating a birth plan like we talked about. We also talk about what do we actually do in those last few weeks of pregnancy? How do we monitor your pregnancy that makes sure you and your baby are still safe? We have a couple of sections on actually preparing for pregnancy. So we talk about preparing your perineum, and we've actually added one in on acupressure during those kind of last couple of weeks, 37 weeks on how you can help prepare for your delivery with acupressure. We also talk about doulas and how amazing and helpful they can be, and if they're the right choice for you. In our labor discussion, we talk about labor and what is it? What's actually happening with your body during that time? And how can you help get yourself into labor? So what are the evidence-based kind of tips and tricks that can help you get into labor if you're kind of going past your due date? We talk about when you rupture your membranes and what that can mean. We also talk about early labor versus active labor, what the difference is there, and how we can help you manage your pain from non-medicinal things like getting in the shower or using the exercise ball, all the way through to epidurals. We talk about what might need to happen if you go overdue, or if you, for some medical reason, need to have an induction of labor. And we also talk about baby's position and how it can actually affect your labor. We then discuss around delivery, the pushing phase. We talk about different types of vaginal deliveries, assisted and then cesarean sections as well. We go through a little tour of the placenta, the amazing organ that it is. We also take you on a tour of our labor delivery at Victoria General, which is going to be relatively similar to many labor and delivery areas. So during the time of COVID, I know a lot of parents-to-be aren't able to actually take tours of their hospitals, so this would give you a good sense of what that looks like. We also go through the operating room, so in case you do need a cesarean section, you know kind of what you're getting into.
And I can say from working in many different hospitals, all the rooms are the same.
Exactly.
Yeah.
We also talk about common complications that can happen at the delivery and how we as your care providers can help manage those complications for you. We talk about vaginal birth after cesarean and twins, and then we also actually go over a section on if your baby needs a little bit of extra support. So there's a preterm birth section, but also if your baby comes out and needs some extra support, how we actually do that.
We've also added in a bonus section, introduction of the team.
Yes, we have.
Yeah. So Dr. Alicia kindly interviewed a few different physicians at the hospital, anesthesia, peds, nursing, so you know who might be involved in your care.
And why they might get involved.
Now, in the postpartum section, we discuss what is, usual things like what's normal bleeding, how to care for your perineum, and we review exercise guidelines after delivery. We also talk about what to watch for in terms of mood, postpartum blues versus depression and anxiety, and how to get the help you need. We review normal newborn care and what to expect in those first few days to weeks at home. We also review how to get your infant feeding routine off to the best start for long-term success, and the hot topic of swaddling.
And I just redid the infant feeding portion because I had a lactation consultant, breastfeeding medicine specialist, review the last one. So we added in lots of great extra information that she thought was so important to getting that off to the right start.
Our course is totally jam-packed with downloads, cheat sheets, and case studies. And don't forget, it's an online course and it's yours. So if you can watch and rewatch sections, you could even watch it at the hospital if you wanted. We give you access to the course for 2 years. So if you decide to have another baby, in that time, you can refer to the course as a refresher instead of having to buy a whole other course. And we love feedback. So we're constantly tweaking it and adding sections. We're working on a couple different sections right now, which will be added within the next week or two as well.
Yeah. So if you purchase the course by Wednesday, the 15th of July by 8 p.m., we are going to add in the bonus of our Newborn Sleep 101 course. This course is so important for new parents. If any of you have seen new parents walking around, they look like zombies because those sweet little babies, they sleep a ton, but they do not sleep all at once. So the course goes over what is normal newborn sleep? What are we going to expect? What can we prepare ourselves for? And it also goes through some tips and tricks on how babies transition to what their sleep is going to be like at 3 to 4 months and what we can do during that time with routines and schedules to really help foster a good sleeper. Because if our babies are good sleepers, that means we get to sleep. And if we sleep, we cope better and we enjoy that special time together more. So that is our added bonus if you purchase this course over the next 4 days. So by Wednesday, July 15th at 8 p.m. Now, if you want to go purchase that course, you can go to our website, www.shefoundhealth.ca, and at the top banner, right across the top, there's the best birth deal. You can also go to the courses section and there's the best birth deal. So that has both courses in one when you purchase it.
So you guys might ask, why this course? Well, like we said at the beginning, Alicia and I are experts in the field. We have thousands of hours of training between us, and we've supported thousands of families through this process. And we've also been through the process ourselves. We've had normal vaginal delivery, induction, cesarean section, forceps, you name it. We've been through it ourselves. The other bonus is that you can watch and rewatch it whenever and wherever you want. Sophia watched it and she said, my husband did not really enjoy going to 2 full days of prenatal classes the first time around, but this pregnancy, he was happy to watch the videos that she thought he should, as they were pretty short, and she says that Dr. Alicia and I had great energy. And her husband's also really busy with work, so he liked that he could watch it after work at home, comfy and cozy, instead of having to leave the comfort of their own home to attend. Now, we are family doctors, and not all women have physicians as their care providers. Many have chosen midwives. Here in Victoria, we work really closely with the midwives, and they're amazing. But birth is birth. And the same principles apply wherever you're having your birth, whether you're having a home birth, delivering in a birthing center, or at a hospital. The same issues can come up, and so it's important to be prepared and have realistic expectations of how your delivery might go, so you can feel strong and proud at the end of it while you snuggle that sweet babe. Colleen watched our course, and she said, the educational video series is like being taught how to prepare for and become an informed mom, but it feels like you're being given the information by a couple of close friends. Sarah and Alicia are experienced and very knowledgeable, but also warm and endearing. A pleasure to watch. Thank you, Colleen.
Thanks, Colleen. So remember, you have until Wednesday, July 15th at 8 p.m. our time, so Pacific Standard Time, to sign up if you want the bonus Newborn Sleep 101 course. So don't miss out. Like I said, it's jam-packed with great information about what to expect, how does a newborn sleep, and how you can help to foster a good sleeper over those first 3 to 4 months.
So important.
So important. So now we know this course may not be for everybody. We get it. So we're offering a 100% money-back guarantee if you decide that the course is not for you within 14 days of purchasing, as long as you haven't watched more than 25% of the content. So really, what's the risk? Go check it out.
Mhm.
Ellen watched the course and said, this was such a helpful course. Although I'm not a first-time mom, it's been a few years, and this was a great refresher that was easy and fun to watch. I don't have time to read all the baby books like I did the first time around. So I found this a much more efficient way of getting the need-to-know information. So that is about our course, and we would love to see if anybody has any questions for us.
Mhm. Okay. So we have a comment here from Jennifer. She doesn't really feel prepared. Classes were moved online and it seemed not well done due to the quickness of the transition to online during COVID. I also feel like they pushed too much of the necessity of co-sleeping and exclusively breastfeeding. The acupressure podcast was helpful. I went to Elements of Health with my partner so he could see how to best help me. They're amazing there.
They're so great.
I went there during all my pregnancies.
Yeah, I went there for my first because I was post-dates and I just wanted to have a baby already.
Yeah.
And they did some acupuncture and I ruptured 2 hours later. So
yeah.
But yeah, it's so true. The online courses are great and convenient, but the same issues apply in terms of you have to have a set schedule. So luckily with ours, you can watch it anytime you want. And certainly we go through all the details from,
everything.
Yeah, lots of options around pain management. And certainly we talk about non-medicinal things as well. So a lot of people worry about having courses done by physicians, but we are granola.
Oh my gosh, we are crunchy team.
So we like to talk about the whole spectrum of possibilities.
Yeah. Actually, just this morning, if any of you follow us on Instagram, I have been up since 4 a.m., but I did have a nap. So I thought, well, I'll work on one of our course sections. So I just completed a new section on our course about relaxation and breathing techniques for labor. So that's something that you guys can practice leading up to the birth. And there's a handout to go with it. So we're physicians, but we approach labor. We're also women who have had babies, and we approach labor in a very evidence-based but crunchy way.
Yes, evidence-based crunchy. That's a great term for us.
Ellen says, hi, Ellen. I feel more prepared the second time around. One thing I think it's good to keep in mind, expect the unexpected. My first birth definitely didn't go as planned, so I definitely appreciate the advice to have plans for different scenarios and necessities that might come up. Absolutely. And I think that really speaks to your birth preferences. And like Alicia said, I don't think it's realistic to say, I won't have a C-section, I won't have forceps, because you just don't know. So you know what you would say is, for some women, maternal exhaustion is an indication for assisted delivery. Totally reasonable. Other women might say only if the baby is in distress, right? But that is up to you. But it's important to know that your labor could go in that direction. It might not. Yeah, you might push for 20 minutes like I did with my third. But yeah, so having expectations and the understanding of how things might go.
So important.
Yeah.
And also to recognize that every single birth is different. So every woman having their first delivery, it's going to be different. And from one delivery to the next in the same person, it's going to be different. And so you just never know. I did not expect to have an emergency cesarean section with my second when I had a vaginal delivery with my first.
Absolutely.
Who would have thunk it? But I did. She's my feisty little Evie Bell now. But I was prepared going in. And so even though I had an emergency cesarean section, I ended up having complications. My daughter was in the NICU for 3 weeks. I still look back on that experience fondly because I made the decisions that I knew I needed to make at the time to keep me and my baby safe. And that is really the important thing. If we can get you the delivery that you really want, obviously we're going to push so hard for that. But at the end of the day, we need to go in eyes wide open for what the possibilities are, because these babies, they have minds of their own, and they start teaching us who's boss right from the start. Yeah.
And I think the section of the course Alicia does, talking about what it might look like if your baby needs more support, is really valuable, because it's actually pretty common that babes need a little bit of help to get breathing going. But for a parent who's not expecting that, it can look really scary when your baby's blue and not really moving. We know that the baby's going to be fine and we're doing the appropriate things, but if you expect that could be a possibility, it's not going to be a traumatic experience for you. You're going to be able to move through it because you understand what's happening.
I was talking about this on our Pregnancy Posse membership group the other day, actually, about how much a transition it is for babies. Literally coming from inside of you, where you're doing the breathing, the feeding, everything all at once. And then they come out and they're all on their own. They have to learn how to breathe. They have to learn how to get their heart pumping their blood around in a different way. They have to then learn how to like crawl up you and breastfeed. Like these are huge transitions that we expect our babies to go through within the first 10 minutes of life. And so there are times that they take a little bit longer, they need a little bit more support. And so really being aware of that is a good thing. Generally speaking, most babies, we can do that skin to skin, a little bit extra rubbing down and stimulating, but some do need a little bit of extra support. So it's nice if you go in knowing that what that might look like. And certainly while we are supporting your babies, we're talking to you about what we're doing and letting you know how they're doing. And you can often come, the partners, the support people can come and be right there next to us while we're doing it as well.
Yeah, Alexis just shared a really interesting comment. I felt pretty confident about my birth decisions until I had an early labor and delivery visit 2 weeks ago. The contractions were very painful, right? And I quickly changed my mind about using pain management. Luckily, baby's still cooking. That's great, Alexis. And I feel a little bit more prepared to visit the hospital when it's time for her to come into the world. Absolutely. You have no idea how it's going to be, and every labor experience can be different, right? And people cope so differently. Like I had epidurals with all my deliveries, and like I've run ultra marathons, like 50 kilometers, but I cannot labor. The pain is just too intense for me. I cannot relax my body. I need an epidural, and I'm a-okay with that. So I think having an open mind, and you know, the advice Alicia said about what Stephanie said, reframing the pain is hugely powerful. And then just, you know, taking it as it comes.
Yeah, for sure.
Yeah, that's a really important message. I was doing totally unrelated. I was doing a Peloton workout this morning. Alicia's going to be like, stop talking.
She loves her Peloton. Like I love my TikTok.
Yeah. But it was my favorite instructor, for anyone who's a Peloton person, Robin Arzon. And she said, I get to do this, right? It was a brutal workout. I was exhausted. I felt nauseous, but it's true. I get to do this. We get to labor. We get to birth these babies, whether they come out the sunroof or out the vagina. What an honor this process is, right? So just these little easy sayings and reframing can be hugely powerful to get through that pain. Yeah.
So we want to thank everybody for coming on today, and we wish you all the best of luck with this experience. Dr. Sarah is going to pull up the birth plan from our site and put a little link in the chats for anybody who is interested in that, in going through that and thinking about what your birth preferences are, getting some questions that you can talk to your care provider about, talking through those things with your support person so they know your wishes going into it, so they can advocate on your behalf when appropriate and when needed. But we really appreciate everybody joining us today, and we hope that this was useful and you got some information out of it that you can bring forward into your birth. And like we said, if you are interested in doing the online prenatal course and getting that newborn sleep course added in, until Wednesday, July 15th at 8 p.m., you can check out our website, www.shefoundhealth.ca. And you can click on the best birth deal, and that will get that there for you. So have a lovely day. Best of luck, everybody. Have wonderful babies, and hopefully we'll see you on our various accounts or hear from you at some. We love hearing birth stories, so send us some birth stories if you're interested. Okay, take care.
Take care, guys.